I'm Olivia Woolsey, and today I'll be presenting with Simone Davis and Patricia Fuller. This is Steve. He has glaucoma. His doctor gave him a prescription to help manage with his eye pressure. Steve uses medical marijuana on the weekends and some weekday nights. Steve never uses medical marijuana before going into work or during work. Steve is up for a promotion. This promotion requires a drug test. If Steve tests positive for medical marijuana, should he be terminated by his employer? A Florida school teacher fell at work. Her doctor prescribed her opioids to help deal with the pain. During the course of a year, the opioids did not work. Another doctor prescribed medical marijuana to help with pain management and avoid the use of a wheelchair. She said the drug worked like a miracle. Under her workers' compensation, she had to disclose her use of medical marijuana with pain management. The school board terminated her after 30 years of teaching. See this family here? This is Kenny. He was diagnosed with epilepsy when he was 16, and he's had seizures ever since. He has recently undergone surgeries and been prescribed medical marijuana. Through these surgeries, he has been able to heal and recover nicely. And Kenny has been now seizure-free for 2 years. He's been able to do things like get his driver's license and spend more time with his kids. Kenny is a great employee. He works hard, shows up to work on time, and he uses medical marijuana. A lot of people say that medical marijuana is a great natural use to cures and to help with other diseases. It's even been known to help with symptoms of Alzheimer's, Parkinson's, and cancer. Some other people strongly disagree, saying that medical marijuana can be used for an excuse for recreational use or even drug legalization, or it may lead to financial problems or outside stressors.
A question to the audience.
Should people like Kenny, Steve,
and
the teacher from Florida be able to use medical marijuana in the workplace?
Of Americans agree with this statement.
Yes, they should.
Medical
Allow
marijuana
medical marijuana.
legal. Here are 2 key points.
So why should you allow medical
The
marijuana?
first key point. Medical
Hi,
marijuana
my name is Simone
can
Davis.
help you
So far in this presentation, we've learned about our first 2 key points, which are perform better and relieve pain.
Key point
I'm
1.
here to introduce our third and final key point,
For some
which is
people,
be
marijuana
healthier.
can be a tool
In the US and all over the world,
in life.
mental health disorders are the leading
How can
epidemic of
marijuana
this
help you
century.
perform better?
Although
Using
back in
marijuana
centuries
can help
ago,
you feel
no one
more
really
focused,
cared
and you can get
about
through your
mental
day
health.
faster.
Now we realize that
Dr.
this is
Cannabis
just as
companies
important as physical health.
Promote the idea that different
Anxiety,
strains
depression, PTSD,
marijuana
and even
can
insomnia are just a
clarity
few
and
of the
productivity.
major mental health issues that
Which
medical marijuana can
strain
improve.
is best for productivity?
Medical marijuana
Many
is
people
able to
say
target a system
Travis
in the
strain
brain which
It's best for
which produces
productivity
fear,
because
anxiety,
it's linked
and
to
nightmares,
lateness.
and even depression.
The CBD
By
strain
soothing
is
this
linked more
system,
to relaxation.
the symptoms and problems allocated
By
with
consuming
mental health
marijuana
disorders
and
are
limited
able to be
doses,
relieved,
one
and the
can
person who
avoid
experiences
the side
these
effects
are
of the drug.
able to have a better and happier life.
By helping alleviate
Eating
pain,
disorders are another
marijuana
thing
has helped
that
patients
medical marijuana can
suffering
help
from
with.
chronic pain
Medical
by
marijuana
focus
can
and productivity
increase
in our
appetite.
lives.
By increasing
Moving
this
on,
appetite,
key point
we can
2.
help regulate
Medical marijuana
the
can
individual's
help
eating
relieve
schedule,
pain.
and whether they struggle with eating too much or eating too little. It can
Marijuana can help people
increase their
with chronic
appetite
illnesses.
in the
Older
correct
people
periods
who
of
use
time
medical
to help
marijuana
them improve their
are less
lifestyle
likely to
and
quit
live a
their job
healthier and
and be in
happier
less
life.
pain.
Medical marijuana is also
Using
able to
marijuana
greatly
can
impact
help
physical
relieve
health
pain
issues.
associated
Cancer,
with these
epilepsy, and HIV are all debilitating diseases
depression,
that, to an
seizures,
extent, cannot be cured.
multiple sclerosis,
However, the FDA has now approved
and
one
also helps
prescription
with
for
ADHD,
CBD
it
for
helps
epilepsy.
treat glaucoma,
This is a great step in the right direction.
and
We
it
should be
slows the
utilizing
development of
CBD and
Alzheimer's
its healing properties way more than we are.
However,
But just this
medical
one
marijuana
approved
is still
prescription
illegal at the federal
is
level.
a good beginning.
Courts are being asked
Medical marijuana
to
can
decide
also
whether
help with
medical
many
marijuana
other health issues.
should be accommodated.
Some of the ones that we
under
just
state
talked
law.
about, including these
The
next
growing number
ones,
of states
have symptoms
Right,
and
employment
issues that
protections,
dwell
and
in
other
the patient for
legalization,
their entire life. We
medical
don't want them to
marijuana-
be living in pain unnecessarily.
Medical marijuana is
Taking
also
over-the-counter
protected
prescriptions
under
and
the
other
state's
drugs
disability
is not
discrimination
healthy
laws.
in the long run. It can
Did you
even
know
increase
that
depression.
medical marijuana
However,
is legal
taking
for
a mood
personal use
lifter,
in 30
and
states?
remember, this does not use THC or any
How to
drug,
get medical
it.
marijuana for pain?
but it is a mood
Because
lifter.
medical marijuana is illegal
And
at the
it is
federal
also a more
level,
natural
doctors
approach
can only
to
get
medicine.
orders
And by doing this,
medication
it can greatly
for
improve
marijuana
their
use.
health and
Doctors are
happiness
not
and their
legally
overall life.
to write out prescriptions
ADD and
for medical
ADHD
marijuana.
are also able to be improved
If you're
with the help
lucky
of
and
medical
you
marijuana.
Get medical marijuana.
Both of these
These
are
different ways that you can take
diseases
it.
or disorders
Number one,
that make it so the
inhalation.
individual cannot
You don't
focus
vape
or
or
hold
smoke
still,
it.
out of many
Number
other
two,
things.
edibles.
However, medical
Gummies,
marijuana is able to
snacks,
calm and
tinctures,
still and help
oils
focus
under
the
the skin.
individual. And so
Number
this
three,
can greatly help them
topicals,
in school
creams
and work,
lotions
and
that
many
you can
other
apply on your
things.
skin.
Parkinson's disease is
will
one of
now
the
hear
most
from
well-studied
Simone
and researched
Who will tell us
with the
how
effects
medical
of medical
marijuana
marijuana.
can keep you healthy.
CBD has an anti-inflammatory and antioxidant properties, and this make it a neuroprotective agent. Because of this, it means that it can specifically impact neurological diseases such as Parkinson's disease. It can stunt the progression of this disease and improve the symptoms of Parkinson's. Tremors and many other things are able to be eradicated and improved while on CBD. So, why should medical marijuana be allowed in the workplace? Perform better, relieve pain, and be healthier. Allow workplace medical marijuana.